Hi there, my name is Dr. Late Night. You're here for a checkup today, aren't you? Wonderful. Well, we'll get straight into it then. I have just a few basic questions for you, and then we will follow that with a short cognitive test just to make sure all of your mental faculties are in order. And following that, we will check your cranial nerves and just do a basic once over of you, okay? Perfect. So if I could just get your name, please. Alright. And your date of birth. Perfect. Do you have any known health conditions? Okay, perfect. So as I said, we're going to begin with a brief cognitive test. So I'm just going to be asking you some questions, and I want to give you a few words to try to remember, and I'm going to quiz you in just a few minutes, okay? So I want you to remember apple, chair, and dog. Can you repeat those back to me? Okay, perfect. And I will be quizzing you again in a few minutes, so just try to keep those fresh in your mind. So next, can you please list the colors of the rainbow for me in order? Okay, perfect. And can you list them backwards for me now? Wonderful. Can you tell me, please, a four-letter word beginning with the letter T and ending with the letter M? Okay. Next, can you list all of the continents for me, please? Okay, perfect. Now, would you spell world backwards for me? Okay. Do you remember what you ate for supper yesterday? Okay. Now, can you tell me a fun fact that you know? Just the first thing that comes to mind. Okay. That is a fun fact. And finally, to conclude our cognitive test, will you just recite back to me those three words that I asked you to remember? Okay, perfect. We're going to proceed now with your cranial nerves and a general just examination of you, okay? So I'm going to check your heart. I want you to just take a deep breath in and out. Good. Breathe in and out. Perfect. And breathe in and out. And one more deep breath in and out. Very good. Your heart sounds fine, as does your breathing. Sounds very normal and healthy. So I'm going to go ahead and put on some gloves for the next part of our exam. do you have any concerns about your health? Anything in particular that you'd like me to check out for you today? Okay. Alright. I'm going to begin with just some facial movements here. So if you can just do what I do, just raise your eyebrows up and furrow your brow. Good. And can you puff out your cheeks? And keep them puffed. I'm just going to tap. Okay, very good. And stick your tongue in the side of your cheek like this. And I'm just going to press on there. Okay, good. And on the other side as well. Okay, perfect. Now give me a big smile. And frown. Okay. Can you make a fishy face? Very good. Now I'm just going to be gently touching you on your face on either side. And I want you to tell me if it feels the same on both sides, okay? There and there. The same? Okay, good. There and there. Same. And there and there. Okay, perfect. We're going to do a little bit of a sharp or dull test here. So I have this light. It has a pointy end and a dull end to it. So I just want you to tell me if you feel the sharp or the dull end, okay? Sharp, good. Dull. Dull again. Sharp, good. Sharp. Dull. Dull, good. And sharp, very good. And just one more time, I'm going to be touching you on either side of your face with the pointy end, and just tell me if it feels about the same on both sides, okay? The same, good. Good. Alright, perfect. Could you please tell me what this is? Good. It is the world, the earth. And if you'll just tell me when, as I'm spinning it, you can see the country that you live in. Okay, perfect. And can you spell out the country that you live in for me? Perfect. Would you tell me, please, what this letter is? And what color is it? Good. I want you to go ahead and cover one of your eyes. Take a good look at the pink color of it. And go ahead and swap eyes. Now, does it look about the same shade of pink on both sides? Okay, perfect. And once again, can you tell me what this letter is? And what color is it? Okay, very good. I'm going to take a look at your eyes next, okay? So go ahead and just look straight at my nose, just relax. Oh. There we go. Just taking a close look at your pupils here. Good, and I'm just going to gently open your eye with my fingers, taking a closer look. Can you look down for me? Okay, and look up. Good, look to the side. Good, and the other side. Okay, very good. I'm going to do the same with your other eye, just very gently holding it open. Can you look up for me? Good, and look down. And to the side. Okay, and the other side. Perfect. Just take a few blinks to readjust right now, okay? Good. And I want you to just gently follow this light with your eyes. Just following wherever it goes. Making sure that the tracking of your eyes is smooth, that the movement is smooth. As it goes away and close in. Okay, very good. Take a few more blinks to readjust. I know it's a bit bright. This is a cool metal. I'm going to put it on either side of your face. Just tell me if it feels equally cool on both sides, okay? There. And there. Good. There. And there. Very good. I want you to close your eyes now, okay? And I'm going to strike this tuning fork, put it by your ear. I want you to tell me when you can hear it. Then I'm going to place my fingers on the tuning fork to stop the buzzing. So I want you to tell me when you can no longer hear it as well, okay? So with your eyes closed. You hear it? Good. Tell me when it stops. Perfect. And the other side. You hear it? Okay. Tell me when it stops. Okay, perfect. Keeping your eyes closed, please. I'm going to whisper something in either of your ears, and I want you to repeat it back to me, okay? Purple duck. Good. Orange pig. Okay, and one more time on either side. 4,000. Okay. 222 million. Very good. Alright, I'm going to, still with your eyes closed, of course, make two sounds by your ear. 1 and 2. And I want you to tell me which sound is closer to you, okay? We'll do this just once on either side. Good. 1 is closer. 2 was closer. Very good. You may open your eyes again. Now, going back to your eyesight, your vision, I'm just gonna have you read a few lines off this card for me. So go ahead and cover your right eye. Okay. And can you just read this line for me? Okay, and then can you read this line? Good. And the smallest line, can you read that one? Okay, a little bit tricky now. Can you read it backwards for me? Good. Go ahead and swap eyes. Okay. Can you read this line for me? Alright, and this line. Go ahead and read this one backwards for me as well. Good, and the bottom line. Can you read that? Okay, perfect. You can open both your eyes again. And I just want you to tell me which way these E's are pointing, please. Perfect. And can you read this sequence of numbers as well? Perfect. We're going to test your sense of smell now. So go ahead and just block one nostril for me and take a deep breath in and out. Okay. And switch nostrils and take a deep breath in and out as well on that side. Alright. When you walk into a coffee shop, can you smell coffee brewing? Perfect. We are going to test your sense of smell just briefly. So go ahead and close your eyes. Take a deep breath. What does that smell like to you? Good. The correct answer is strawberries. Although I'll take any similar fruit. You can open your eyes again now. That concludes our general checkup and cognitive assessment today. Do you have any questions for me? Okay, perfect. Well, it was a pleasure seeing you in my clinic. Just know that you're always welcome here, and it's very important to stay up to date on your health and to keep getting checked out just in case anything comes up, but I don't foresee that. Okay, so I'll see you again soon for a cranial nerve exam, an eye exam, and whatever else you need. Wonderful. Thank you so much. Have a good night.